Hello all. In this video we will see about general surgery previous year questions and important questions for BDS students in third year exam. So by learning these questions you will be able to attend the maximum number of questions asked in exam. So it will be really useful for your last minute preparation. So starting with the chapter wound healing, these are the questions asked in the chapter like stages of wound healing. It is a very common question, and factors affecting wound healing, causes of delayed wound healing have been often asked. Normal healing in bone, nerve, and tendon have been asked as an essay once. Management of an acute wound and infected deep lacerated wound. On the right side of cheek, the management steps have been asked as an essay. The location of the wound can change, but infected deep lacerated wound, you should know the management and also management of acute wound. Keloid and hypertrophic scar both are related. You should know the differences also. Then crush syndrome, there is also another syndrome, compartment syndrome. So you should know that also. Fracture healing, complications of fracture healing, healing by secondary intention. So if secondary is asked, you should also know about primary intention also. The next chapter, swellings, ulcers and growth. In this chapter, you have questions related to ulcer like rodent ulcer. It is also dealt in the chapter of neoplasm. So it's a carcinoma, basically basal cell carcinoma. It is asked as an essay. Pressure sore or bed sore, trophic ulcer, diabetic ulcer, ulcers of the tongue, differential diagnosis. So what are the possible causes of ulcers of the tongue? It has been asked once. Cystic hygroma, hydrocele of neck, both are related. You should know the difference. Fournius gangrene, the gangrene of the genitals. So you should know about it. Dermoid cyst, you should classify and give example for each type of dermoid cyst. Implantation dermoid alone has been asked as a short note once. So brown tumor, various causes of lymphadenopathy have been asked as an essay. Brown tumor is seen in parathyroid related issue. Lipoma, it's also known as the universal tumor. So if they ask universal tumor, you should know it is about lipoma. Sebaceous cyst, and these are developmental related issues. Preauricular sinus, branchial cleft cyst, branchial fistula, and thyroglosal duct cyst. Cervical adenitis, it is also dealt in the chapter of infection and inflammation, because cervical adenitis is usually due to tuberculosis. There are also other causes like neoplasm. You should know about it. Pyogenic granuloma of lip. Usually pyogenic granuloma as a dentist we will see in the gingiva most commonly. Here they have asked it about lips. And giant cell epulis, any swelling of the gums, it is known as epulis. In periodontics you will have another name for the gingival swelling. Here in general surgery it is usually referred to as epulis. Ranula, hemangioma, ganglion. Ganglion, this doesn't mean about the nerve cell collection. It is a swelling in the hand region or tendon region. You should know the difference between the anatomical ganglion and here in surgical what is ganglion. Sternocleidomastoid tumor, potato tumor, and neurofibroma. Regarding ranula, you will see more in the swellings of the salivary gland. So next is the neoplasm. In neoplasm, we have carcinoma cheek, carcinoma tongue, and carcinoma lip asked as essay often. You should know that the basic things are common for all these three. Or in general, oral cancer, if they ask any three question, like you can prepare the same notes for all. Like the investigations are the same, the causes are same, etiology, pathogenesis, mostly it will be the same. Only the management part differs. So the surgical management, what kind of technique you will use, especially tongue, it will differ. So you should know about that. Pre-malignant skin tumors, it is more common. Like pre-malignant conditions, they have asked as an essay, as you could see here. Erythroplakia, oral submucous fibrosis have been asked as separate questions. You have viruses causing cancer or carcinogenic viruses. So the classification of the causes of the oral cancer and management of oral cancer have been asked as an essay separately. Basal cell carcinoma, as we saw there, rodent ulcer, hamartoma, and neoplasm alone you have to classify. That also have been asked as a question. So marginal mandibulectomy, it's a management of tumors. Trotter's triad, it is seen in Which carcinoma? Please mention in the comments if you know. Benign tumors of tongue, brachytherapy, neoadjuvant chemotherapy, principles of radiotherapy. All these three are related to the management, chemotherapy and radiotherapy. Malignant melanoma is also one of the commonly asked neoplasms. Metastatic cervical lymph node neoplasm. Mention the possible primary sites, clinical features, and management. It has been asked as an essay, so you should be careful regarding that. The next chapter is on inflammation or infection. The TB lymphadenitis is the most common question in this chapter. It is also known as cold abscess, and the difference between the cold abscess, cholesterol abscess, everything. Tetanus, gas gangrene, rhizus sardonicus. We will see in the next page. This also feature of tetanus has been asked. Syphilis, they have asked about oral manifestations, stages, congenital syphilis separately. Cervicofacial actinomycosis. Actinomycosis alone has been asked as a question once. Carbuncle, anthrax. So, malignant pustule is related to anthrax. Both have been asked. Surgical site infections. Nosocomial infections are infections in the hospital setup. So, you should know about that. Necrotizing fasciitis, cellulitis, both have been asked. Caseation necrosis. Necrosis classic in TB. You should also know other conditions where caseation necrosis is seen. And lymphangitis, laryngeal edema. You should know the causes of laryngeal edema. Infection is one of the causes for laryngeal edema. Rhizus sardonicus is a feature in tetanus. Pharyngeal abscess. The next chapter is on nerves and the related issues. So here the two common nerves related to the face, head and neck region. Being dentists, you should always note that any one essay will come from the head and neck region, and most of the short notes will be concentrated on the head and neck region. So as a dentist, the nerves which you are concerned will be facial nerve and trigeminal nerve. So both will have an important part in your question paper. Facial nerve injury or facial nerve alone have been asked. Course and branches of facial nerve in the cheek and the effects of its injury. Peripheral nerve injury and its management. Fraze syndrome. Trigeminal neuralgia have been asked. And peripheral nerve injury, there are two major classifications regarding peripheral nerve injury. Axonotmesis and treatment. Neuropraxia have been asked as separate short notes. You should know the classification also. And Horner syndrome have been asked. So next chapter is on blood and hemodynamics and the diseases of the arteries and the veins. Shock, as you could see here, they have asked multiple essays on the topic shock. Neurogenic shock, various causes of shock and its management alone have been asked. Hemorrhagic shock, septic shock, hypovolemic shock. You should be thorough with all of these, and management in each type is must. Disseminated intravascular coagulation and hemophilia, two diseases related to your bleeding and clotting system. Hodgkin's lymphoma, classify lymphoma and its management. It have been asked as an essay. It is important surgically, so they are asking lymphoma here out of the neoplasms. So, importance of the RH factor in pregnancy has been asked as an essay. You should write about erythroblastosis fetalis and how to prevent it. So it is also a separate question. Methods of arresting bleeding on the table, surgical table. Methods of hemostasis in surgery. Both are the same questions. Aneurysm, types of cervical rib. You should know the relation why cervical rib is included in chapter related to blood. Okay, what are the types of cervical rib? Universal donor, universal recipient. What does that mean? So you should know about it. Complications of blood transfusion, indications for blood transfusion. All these chapters are related to the blood transfusion. There is a separate field like transfusion medicine. So you are just learning the basics. Okay, blood grouping and cross matching, transfusion reactions, what could happen there, diseases transmitted by blood transfusion, the basics of blood transfusion. Hemorrhage, how you will manage it, the clinical features. Reactionary hemorrhage, what is primary hemorrhage, secondary hemorrhage, reactionary hemorrhage, all you should know. Because hemorrhage is an essay. When they ask like that, you should write about everything. Blood substitutes, what can be used instead of blood, okay? And what are the blood components and their uses, blood fractions, okay? Various blood byproducts and its use. Subdural hematoma, it is also dealt in the chapter of injury and fractures. Raynaud's disease, what is it? Claudication pain in the legs while walking. Why does that happen? What is the pathophysiology behind the claudication pain in the legs? Hyperkalemia and hypocalcemia have also been asked. So the next chapter, fractures and injuries. Maxilla, as I said, head and neck comes first. Mandible, both will be there. So leaf-foot fractures will also be there. It is also an essay. And zygomatic arch fracture have been asked. Also nasal orbital ethmoidal will also come under your fracture management. For fractures, as a dentist, you could refer to your oral surgery books for more notes, more than just your general surgery books, because general surgery books for dental students will be very simple. Either you should refer the general surgery book for medical students, or for these topics you can refer your oral surgery books, which you will actually learn in the final year. But questions regarding the topics which overlap, you can definitely learn from your oral surgery books for good marks. CSF rhinorrhea, one of the complications of leaf-foot fracture, leaf-foot 2 and 3, and investigations and primary care in the facial-maxillary injuries. So you should know the basics, okay? Kernohan's notch, what is it? Lucid interval, what is it? Subdural hematoma, where, in what cases it happens? And Glasgow coma scale, what is it? Interpretation of the coma scale. The next is salivary gland. In salivary gland, major gland is the parotid tumor. Parotid gland, mixed parotid tumor or pleomorphic adenoma is a commonly asked, often asked essay. And classify the salivary gland swellings have also been asked as an essay. Malignant pleomorphic adenoma, tumors of the parotid separately have been asked as an essay. Salivary gland tumors also have been asked. Surgical anatomy of the parotid gland. As you could see, most of the questions are on the parotid gland. Okay, facio-venous plane of Patti. Again, it belongs to surgical anatomy of parotid gland. Complications of parotid gland surgery, Wharton's tumor. Cryolithiasis, salivary calculus. Now only they have moved to the submandibular gland. Cryolidinitis in submandibular gland is often asked as an essay. Cryolography or cryologram. What is the purpose? What is the indication? Okay, and parotid abscess have also been asked. Head and neck, this is a huge chapter because most of the questions will overlap in the other topics, will be gathered here in the head and neck. As your dentist, it will definitely many questions from will come from the head and neck region. Ameloblastoma, dentigerous cysts of the mandible, cystic lesions of the mandible. It's common essay. Dental cyst, lymph node swellings, we already saw, right? TB lymphadenitis or cholesterol abscess. You should also know about that, an essay. Block dissections of the neck. So levels of the cervical lymph node. Again, it is important. Cleft lip and cleft palate. Another important topic, the clinical features, classification, management, rule of 10. What does that mean in cleft lip and cleft palate surgery? Techniques of cleft lip and cleft palate surgery is an important essay. Killian's dehiscence, where it is present, what is the significance of it? Comparing ranula and sublingual dermoid, how will you differentiate between both? Oral ulcers, what are the different causes for oral ulcers? How you will differentiate it? So aphthous ulcer, one of the most common oral ulcers. Clinical picture in the adenoid enlargement, what you will see there, how you will diagnose it. Development of tongue, development of face, both are development related question. Even cleft lip and cleft palate also will overlap in the embryology. Okay, you should write about the development of cleft lip and cleft palate when talking about the you should write about development of palate and lip when talking about cleft lip and cleft palate. Submucosal fibrosis, oral submucous fibrosis, one of the most common pre-malignant condition. There are two things, pre-malignant lesion and pre-malignant condition, which will be dealt in detail in your oral pathology. So you should be thorough with both. Importance of retromolar trigone, micrognathia, dangerous area of the face, why it is dangerous. Stomatitis, trismus, why does it happen? Cancrum oris, chemodectoma or carotid body tumor. It also has another name. If you know, please comment it. Alveolar abscess, Ludwig's angina, osteomyelitis of mandible. All these three are consequences of dental caries most commonly. Peritonsillar abscess, the old name of which is quinsy. So quinsy alone will be asked many times. So it is about peritonsillar abscess. Torticollis or wry neck, a problem in the sternocleidomastoid region. Waldeyer's ring, it deals with the tonsils and adenites. Epulis, as I said, it's a swelling in the gums. Odontoma, also known as odontomes, Oral cavity ulcers we saw previously. So what are the different types of oral ulcers? How you will manage the malignant ulcer of gingiva and alveolar ridge? As I said, the whenever malignancy is dealt, the etiology will be the same, clinical features will almost be the same, investigations will be the same, but management alone differs for each site. So here they are clearly asking about management of malignant ulcer of gingiva and alveolar ridge. Orbital cellulitis, glossitis. The next chapter is on thyroid. In thyroid, you have thyroid swellings, classification, multinodular goiter, solitary nodule thyroid, hypothyroidism, hyperthyroidism. Both are important. In hypothyroidism, you have cretinism, myxedema, and in hyper, you have thyrotoxicosis, the management, Graves' disease, clinical features, investigation, and management. See, the all which I have marked as E belongs to SA. Thyroid crisis have been asked. Riddle's thyroiditis, autoimmune thyroiditis alone have been asked. Hyperparathyroidism related to thyroid. It is one time it has been asked as an essay. Papillary carcinoma of thyroid. Only question from the malignancy side of thyroid. You should know about other tumors also, right? The histopathology of all the tumors of thyroid. Thyroidectomy. In what cases they do that? Blood supply of thyroid. Iodine 131. Reconstructive surgery is the next topic. Here you have flaps and graft. In flaps, you have pedicle flaps used in reconstruction of cheek and its blood supply, flaps used in oral surgery, pectoralis major myocutaneous flap. In graft, you have skin graft, split skin graft, composite skin graft, Wolff's graft, which is full thickness graft, and a xenograft. It could be bone graft or skin graft, but it is taken from other species than human beings. Burns. In chapter of burns, you have degrees of burns, classification burns, the pathogenesis, calculation of percentage. How you will calculate it? You have a formula for that. Post burn contractures, Marjolin's ulcer, rule of 9 in burns. It is again the classification of percentage related to that. Late complication in burns and their management, chemical burns. Anesthesia, in which you have been asked only two questions like anesthesia and dentistry or local anesthesia and nerve blocks. You should also know about pre-anesthetic medication, what are the instructions to give before anesthesia. So those things are common. So final chapter, general topics related to surgery. Biopsy, it is one of the common investigations in neoplasm or other suspected cases. Types of biopsy, incision biopsy, frozen section specimen. Tracheostomy, it is often asked as an essay. It is an emergency procedure which everyone should be knowing. Indications, procedure, complications related to that, and care of tracheostomy patients have been asked. Surgical instrument sterilization. Sterilization is again important, and you have been repeatedly learning from microbiology. It will be asked in final year also, so it's better to be thorough with sterilization and disinfection. So they have asked about glutaraldehyde alone once, sterilization methods, suture materials again, and suturing techniques, classification of suturing materials and its usage. Informed consent. It is actually an ethical issue. You should know about informed consent and how to get it from patient. So systemic inflammatory response syndrome, multi-organ dysfunction syndrome, both these syndromes have been asked. Classification of management of maxillofacial injuries, we already saw in the fracture chapter. Antibiotic prophylaxis for dental procedure related to our field. Use of laser in surgery. What are the regions where we use laser? What are the purposes? Apart from cutting, what other uses laser has in surgery? Nosocomial infections, the infection in hospital region. And this is related to hepatitis and HIV. Hepatitis B prophylaxis, HIV prophylaxis, universal precautions in OT, where we should take and how we should take it. Universal precautions while treating HIV patients, both are almost same. HIV AIDS and the surgeon. What are the precautions as a surgeon we should take? Ultrasonography, MRI, both are diagnostic parts. Pulmonary wedge pressure monitoring have also been asked, and the use of MRI in the head and neck lesions have been asked. So next video will be on general medicine important questions. So I hope this video will help you in preparing for your general surgery exams. So see you soon in the next video. I will try to upload a video on explaining each question. We saw the questions alone. If possible, I'll upload a video explaining 2 or 3 points about each topic. If you want a video like that, please let me know in the comment section. So we'll soon see you in the next video on general medicine important questions. All the best for your exams.